Well, we're currently caring for people in a very hospital-centric model, and we know that we've got very high readmission rates for people with some chronic diseases, and in particular, chronic obstructive pulmonary disease and chronic heart failure. What we could do differently is integrating the care that we're providing for people across all of the different sectors with our GPs, with our community partners, and with our specialist teams and local health district community teams.
Collaborative commissioning is a whole-of-system approach to providing patient-centred care across the health and social service continuum. Existing services and funding will be realigned to commission services that matter to patients and clinicians.
If you've got a chronic disease, you've got a disease for life. And there are so many different doorways and so many different pathways that you are required to go into to get that bit of care here and that bit of care there. So Living Well Your Way is our way of talking about completely redesigning how we look after care for people with a chronic disease.
Our solutions will be evidence-based, informed by local data, and importantly, co-designed with local patients, carers and providers. We will monitor and assess the performance of both services and the system, and share accountability for outcomes.
We also know that people who live in different geographical areas of our region have different levels of access to specialists, to allied health clinicians, to people who will help you to live with your illness over a long period of time. So collaborative commissioning is just a fancy way of saying we're going to bring all of the partners together, we're going to create an agreed pathway, but you are going to be the person that is the most important in helping us design that pathway.
Stakeholder partnership and input is essential in the design phase. We know that people who require care from multiple providers to manage their health conditions often experience difficulties navigating the health system and fragmented care. To redesign the system that effectively wraps around the needs of a patient, we need to understand the patient journey as they navigate our health system.
There has to be joint responsibility between partners, between GPs, between private providers, between specialists and between hospitals. That strong consumer engagement is really important. This is a very large-scale change. From a chief executive of a local health district, the care that we are funded to provide is in the hospital. But we are now wanting to break down those barriers and have a completely different approach to how we use the funding that we get to care for people with chronic diseases. And we want to base that on outcomes for you.
Clinicians frequently report barriers to providing effective care as a result of poor integration between care providers and communication between the hospital and primary care. Living Well Your Way will provide the opportunity to support local providers to build capacity and achieve better outcomes for patients through the development of different funding mechanisms and models of care.
And finally, we need to make sure that we consider all of the cultural requirements of all of the diverse population we have across our region. That includes Aboriginal and Torres Strait Islander people and people who come from culturally diverse backgrounds. We need to get it right for you. So please, during the design workshops, this is our chance to redesign our services and get them right for you.
Please join us from October 26th to 28 to inform the development of our local model within the Murrumbidgee.